I'm Jordan Klebanoff, and I'm a fellowship-trained, minimally invasive gynecologic surgeon. And what that means is that after my 4 years of OBGYN residency, I did 2 additional years in just complex gynecologic surgery and doing those surgeries in a minimally invasive fashion. The majority of those surgeries are robotic or laparoscopic procedures. This has been groundbreaking, and there's ample evidence to suggest that it is always better for a patient to have minimally invasive gynecologic surgery. You're going to decrease things like postoperative pain, postoperative complications, length of hospital stay, and a sooner return to a normal life. The conditions that I commonly see in my gynecologic practice are going to be endometriosis and pelvic pain, abnormal uterine bleeding, and whether that's due to a fibroid or a polyp or any other non-structural cause, adnexal masses or cysts on the ovaries or fallopian tubes. The procedures that I'm most commonly performing are going to either be a robotic hysterectomy. I also perform a lot of robotic myomectomies or fibroid removal surgeries, and then I do a lot of hysteroscopic procedures, which are surgeries all done through the vagina, no incisions on the abdomen, and I'm operating inside the uterus with a camera. When I meet with my patients in the office, my goal is to take a complex gynecologic condition and break it down into simple terms and ones that they can understand. And then we lay out a treatment plan, and that may be the medical management of that problem, but often they're coming to see me for the surgical management of a complex condition. For a lot of the patients that I treat that I'm seeing with chronic medical problems, they've often come to me after being told by a variety of other providers that this is just kind of their normal life. And when I'm able to lay out for them a treatment plan, whether it's medical or surgical, and tell them that life can be better and that you don't have to live in this chronic state, it's really been amazing to see how quickly other OBGYNs have been able to trust my abilities and send me their patients. It takes a lot for an OBGYN to tell a patient, please go see this other specialty surgeon that we have here who can provide you a service that I cannot. And that really is why I was brought here to Main Line Health, to be able to provide those services for OBGYNs and people in the community. When you take a complex gynecologic condition that is really impacting a person's quality of life, and you can provide them a robotic or laparoscopic surgery that will have them back to a normal life in 2 to 3 weeks, it is extremely satisfying.